You've taken the big step towards the chest of your dreams with gynecomastia surgery, but your journey is really just beginning. That's because you have a lot of massaging to do at home while you recover, but when should you start? How should you massage? How intense should it be? We're going to answer all those questions and even talk about some bonus techniques that not many people talk about. So stick around to the end and let's get into it. When to start massaging. When you get home from surgery, you're gonna have 2 days until we begin massaging. Those first couple of days after surgery, you're gonna be pretty sore, especially if you had a lot of tissue removed and liposuction done. So it's best to wait until post-op day 2 before starting any massaging that you'll be doing on your own at home. The main thing to start with in the week of surgery though is lymphatic massages with a professional. A professional lymphatic massage is a great way to get a lot of the swelling moving and allow your results to shine through a bit sooner. I recommend to my patients to get 2 lymphatic massages a week for the first 2 weeks. This is going to help get a lot of that swelling and inflammation out of the chest area and allow you to start seeing your results sooner. And if you feel like the lymphatic massages are helping, you can continue to get them for as long as you wish, or even transition into getting deep tissue massages to help break up the scar tissue. Now that you know to start your massages on post-op day 2, let's talk about how to massage your chest so you can get the best results possible. You're going to go through several stages in your recovery depending on how many days out from surgery you are, and with each stage we're going to introduce a new massage technique. The main thing to keep in mind with these massage techniques is that we're trying to prevent the buildup of scar tissue, which can lead to contour irregularities or even puckering of the nipple. So to prevent that, we have to start early, and that's why we start on post-op day 2. So starting on post-op day 2, you're going to start with manual massages of the chest and sides of the chest. To start, you're going to use 2 or 3 fingers and apply light pressure over the compression garment and begin doing circular massages. The pressure should be enough to be slightly uncomfortable, but it shouldn't be painful. If you have lipofoam in place, you can massage on top of that until it's gone in a few days. During this time, you're not going to massage directly over the areola itself because we don't want to stress the incision and create the opportunity for wound breakdown. You also want to massage along the sides of your chest if you've had liposuction out there as well. You'll do this massaging 2 to 3 times a day for about 20 to 30 minutes at a time in these early stages up until about post-op day 10. Manual massage is going to be your go-to technique for the next few months because you can do it in the car, at a stoplight, at your desk while you're working, or even laying in bed. So starting on post-op day 10, you're gonna start using a roller to massage your chest. The roller is going to allow you to apply a little more force to the scar tissue that's developing and help soften it further. You might be wondering, what kind of ball roller do I get? Where do I get this? Well, you can get them off Amazon, and it's very easy to get a hold of these. I like the ball roller from Nobility that you can get on Amazon for about 30 bucks. This video isn't sponsored by them, but I do like how you can heat up the metal spheres with some warm towels and then roll them across the chest. By heating them up, you can help soften up the tissue while using these, and also that heat helps dilate the blood vessels, so allow some of that swelling to get out of there a little sooner. Just make sure to check that they aren't super hot before applying them to your skin, since your chest is probably going to be numb in some certain areas, so you don't want to get burned. To use the roller, you're going to start away from the areola and press it into the chest, and then roll it up towards the underarm area from inner to outer. This will help move your swelling into the lymph nodes that are all located in the underarm region. The other reason why I like the Nobility roller is if you don't like the handle, they have the ball roller as well. So it fits straight in the palm of your hand, and you can rub this thing in circles all around your chest, getting down all the way along the border of the pec major and all the way along the outside. And remember, if you aren't uncomfortable with how firmly you're pressing while you roll, then you aren't doing it hard enough. The other thing to remember is that you aren't going to roll over the areola at this time either. That wound is still healing, so give it a little room when rolling on the chest. Now you can roll near it, but you need to use a little less pressure. So you can go underneath it, on the outside of it, on the inside of it, above it, and just roll everything out towards the underarm area. Starting on day 14, you're now ready to begin using a massage gun. But keep in mind, you don't necessarily have to use this. You can continue using the roller, you can continue using your fingers. These are just devices that can help accentuate your results a little sooner and get some of that scar tissue softened up a little sooner as well. Now you can get these off of Amazon for less than 100 bucks. So again, you don't have to break the bank for this. And in fact, I'll leave a link in the description below for you guys to check these out. They're not affiliate links, just I want you guys to be able to find the equipment that I'm talking about here, and if it helps you out, then go ahead and get it, but they're not affiliate links. So now the nice thing about these massage guns is that they come with multiple tips, and the one that I usually recommend to my patients to start out with is this little orange one that comes with our kit. Now it's very soft, you can see it's pretty squishy here, and it's going to be much easier to start with this one rather than some of the more aggressive ones. So to start off with using the massage gun, First turn it on, but make sure it's on the lowest setting. For this one, it's a 1. You'll use the massage gun from day 14 until about 2 to 3 months after surgery, depending on how you're healing. I recommend starting with the ball tip for the first week or so and then progressing to the other tips. You can experiment and eventually find the one that works best for you. Start off with the lightest intensity first using the softer ball tip. Start by working the chest and the side of your chest in small circles. Avoid going over the areola until about post-op day 21 because at that point the wound should be healed enough to handle the lighter settings. Do this for about 15 to 30 minutes at a time with 2 to 3 sessions per day. If you can go a full 30 minutes with the device, that's great, but at minimum get the full 15 minutes. Again, you can do this on the couch, working from home, or anywhere else that you're comfortable breaking out this device and getting your massages in. If you feel weird using the device in public, then go ahead and use your hands. As long as you're massaging, you'll have a better chance of getting the results that you want. As the weeks go by and the intensity from the lowest settings doesn't seem to cut it anymore, then you can start bumping up the intensity. And some of these will go pretty high. So take it easy, wait until day 21 to start going over the nipple with it. After that, you should be good to go with whatever you're comfortable with. And you can even start switching out the tips. Now this one is a kind of spatula tip. This one is really good once you really want to start getting aggressive, because then you can start really working it and raking it across the chest here. But eventually you're going to find the tips in that kit that work best for you. So keep using those as long as you feel like you need them. So here's something extra that people don't really consider when recovering from gynecomastia surgery, and it's stretching. Now you probably didn't think we would be talking about stretching in a post-op recovery video, but here we are. The reason we need to talk about stretching is because it helps to break up scar tissue as well as keep the range of motion in your joints going. Some patients are pretty uncomfortable after surgery and end up not moving so much, so things can get a little stiff in the shoulders and in the chest. Stretching is going to help get the joints moving again, but it will also help prevent the areola from getting stuck down to the chest as well. By keeping the areola free, we decrease some of that risk of puckering or depressions in the areola, especially where the incision is. So when do you start stretching? I recommend to my patients to wait until post-op day 14 before they start their stretches. And that's mainly for my patients that have a small incision in the areola and a little bit of liposuction done out here on the outside with just a tiny incision here. And you are definitely going to take it easy from day 14 to 21. Start off slow and don't push it. Stretching too hard too soon before day 21 will increase the risk of breaking open a blood vessel and developing a hematoma. We don't want that. So listen to your body during the first week of stretching. After day 21, you can start ramping up the intensity as much as you can tolerate. For those of you that have a large incision across your chest due to having grade 4 gynecomastia, I want you to wait until post-op week 4 before you begin stretching. Your wound needs a little more time to heal before we go stretching on them, so we don't end up stretching the scars as you heal. But what type of stretches should you do? Well, on post-op day 14, you're going to start with overhead stretches. You're going to take both of your arms and try raising them up over your head. You should feel stretching along the sides of the chest and along the border of the pec major. If you can't get all the way above your head, go as high as you can and hold it there for about 10 seconds to let that stretch settle in. The other option is to spider walk up the wall. You're going to stand in front of the wall about 2 feet away and begin walking up the wall with your fingers. When you get to a point where you feel a bit uncomfortable, go ahead and stop and then hold it there for about 10 seconds. After that, bring it back down and then repeat. You should be trying on the next attempt to get to the same height or just a little further. Keep doing this until it's easy to get all the way above your head and you no longer feel the tightness in your chest. Another variation you could do is standing with the wall to your side and then spider walking up the wall that way. If the overhead stretches are not making you uncomfortable, then it's time to start with the elbow stretches. These are going to help stretch the outer border of the pec major and along the chest wall where you may have had some liposuction done. This stretch is going to help loosen up the scar tissue along the border of the pec major that can sometimes develop into a cord-like structure. To do these stretches, you're going to bring your elbow up and then grab it with the opposite hand and then pull back till you feel that stretch down your tricep and into the side wall of your chest. I want you to hit a stretch that feels a bit uncomfortable and then hold it there for about 10 seconds or so. Do that about 5 to 10 times per session with about 3 to 4 sessions per day. If you don't feel the stretch down the side of the muscle, then go ahead and lean away from the elbow that you're stretching. So for example, if you don't really feel it so much here, then you can just kind of lean into it there and really get that, oh, that feels good. Yeah, you can really get that stretch in there. I might have to do this on a regular basis myself. If the elbow stretches or the other stretches are a little too intense, or maybe they're just super easy for you, then it's time to start working on the overhead door hangs. What you can do is start out with your hand on a door ledge or some other handle up high, and then slowly ease your weight onto your arm. Eventually, you're going to be hanging from the arm or both arms to get those stretches in. But that's not gonna be for about 5 to 6 weeks after surgery, so don't plan to just hang from anything anytime soon, starting on day 14 or 15. I want you to ease into these. Once you're hanging, or at least put some of your weight on that arm, try and hang there for a few seconds at a time and eventually build up that hang time to really work on stretching all that scar tissue out. The other way that you need to stretch your chest is outward. This is going to help release that scar tissue on the inner portion of the chest. You can do this in a couple different ways, but the easiest is to grab the corner of a wall and take a step forward while twisting away. You should feel that stretching on the lower portion and inner portion of the chest. Make sure to hold these stretches for about 10 to 15 seconds at a time while you're a little uncomfortable holding it. You'll do 3 to 4 of these stretches at a time during each of your 3 to 4 stretching sessions a day. Eventually, these stretches will get easier, but it's important that you keep doing them for about 2 to 3 months post-op in order to get the best results possible. But what happens if you don't get the results that you wanted? Then what do you do? Well, to answer that question, you can watch this video right here. I'm Dr. Paul Pearce, and I hope you learned something today. I'll see you in the next video. Once you put it in, you start off on the lowest setting. So what you're gonna